Hi, Dr. Tillisch, and welcome to the GI Health Summit. Thank you so much for being here. I'm really excited for the opportunity to talk to you.
Well, thanks for having me. I'm happy to be here.
It is my pleasure. So, Dr. Tillisch, what is GI health? How do we know if we have it? How do we achieve it? And once we achieve it, how do we maintain it?
Yeah, well, it's actually a pretty big question. So, GI health is not one of those things where we can do a test and say, aha, you did this blood test, or you did a stool test, or we did an x-ray, and that's GI health. Really, the way we look at GI health is, how do you feel about how your gut's doing? And that really is whether you're feeling symptoms of discomfort, whether things are moving easily down the GI tract, whether you're distracted from it in your day. Do you feel heartburn? Do you feel bloating? Any of these symptoms that are bothersome through the day and are really common among people throughout the age span, throughout the world, really, but very common in the US. And it's really not noticing the GI tract often is GI health. So that's one piece of it, how you feel about your gut. And most of us, anything that goes on in the GI tract, for the most part, it comes up to the brain, and the brainstem is able to say, oh, everything's fine. We don't need to hear about that. Leave that alone. And really, we only get information when we need to. And that's usually from a simple thing like you have to run to the bathroom, or you need to eat something, or something really serious is going on and you need to talk to your doctor. So most of our GI health is going to be lack of information from the GI tract. That means it's working well. The other piece of it is, however, the more complicated piece of GI health is the fact that the GI tract is our biggest interface really with the world and how we get our nutrients. And it communicates with all of our organ systems. And if our gut is not processing things well, we're going to have an increased risk of all kinds of other diseases. So it can impact heart disease, it can impact diabetes, it can impact our risk for cancer. So it's not just GI symptoms that are important in GI health. Having GI health really helps our overall health as well. So it's really a big thing, and it's key to our overall well-being.
How did you get interested in integrative medicine for helping people with their GI issues?
Yeah, it really came not so much from me, but from my patients. I was trained very traditionally. I didn't have any integrative medicine training. But when I went to see the patients, the ones I was most interested in were people who had chronic gastrointestinal disorders that we couldn't really figure out, and we didn't have the right medicines for. And so they often would get really frustrated with their doctors, and doctors would get frustrated with them because they weren't able to come to the sort of solution that would make everybody happy, mostly the patients. And so they would say, oh, well, I was going to try this, I was going to try that, a supplement, an herbal medicine. There was a study way back in, I guess, the 90s about traditional Chinese medicine and irritable bowel syndrome, herbal medicine and acupuncture that got me really excited. There were some studies in other pain disorders about mindfulness-based stress reduction and mindfulness meditation. And when I learned about those, I thought, wow, this sounds just like what's going on with my patients. And so I just reached out and I started learning about things like mindfulness and yoga and hypnosis and acupuncture and herbal treatments. Probiotics came more popular. And I started learning about all of these things that I could use to help support my patients rather than say, I don't know, I'm a doctor, I don't do that. I realized like, oh my gosh, I need to know all of these things so that I can help people. So I got trained in a lot of different areas and found that, yeah, this was a way that I could really help people. And at UCLA, build a multidisciplinary team of nurses, mindfulness instructors, psychologists, dietitians, where we could kind of broaden it even more and bring together sort of the package that we need to treat patients. And then it perfectly aligns with the work that I've done as a researcher. So in parallel, I've been studying the brain and how the brain and the gut are connected. And when we get to studying that connection, it's something that's really clear anatomically. You can find it in an anatomy book. Here's the brain. Here are all those nerves that go to the nervous system of the gut, which is really complicated. So they call it the second brain. We know that's there, but we really didn't know how they interacted in a practical way. And so working with a team at UCLA, I've done a series of studies looking at the brain with functional MRI imaging, structural MRI imaging, and trying to really understand when we perturb the system or we make changes, how can we show that things are affecting the gut? And it completely meshes with integrative medicine, because most integrative medicine is doing something similar. So acupuncture is changing the autonomic nervous system, which is what we're studying, that connection between the brain and the gut. Mindfulness, hypnosis, other behavioral therapies are changing and remodeling the brain in those areas that perceive pain and discomfort and distress from the GI tract, and send down signals to the GI tract to make it act differently. So my research was going one way, and my clinical practice was going another way, and they beautifully came together in a way that has been really fun for me, and I hope helpful for the people that I take care of at UCLA.
The modalities you talk about sound wonderful. The people I know want to feel better now. They're looking for a pill.
Yeah. Story of our life, right? We want that magic drug that's gonna fix things. And often when I'm talking to a patient, for example, with irritable bowel syndrome, I may be talking to somebody who's had symptoms for a decade or more, or maybe just a year, but they've had symptoms for a long time. And they'd like, well, I want that thing that's just gonna make it better. And we look and we say, well, what do you think is causing the symptoms? How do these symptoms come about? And they come about really from our genetics, our upbringing, what happened, what diseases we may have had, what stressors we may have had, and how our nervous system developed in conjunction with the nervous system of the gut. And then something may trigger the symptoms to get worse, activates a whole bunch of different pathways that lead to the distress of the onset of these symptoms. And then we have to say, oh, I'm going to give you a pill that makes that better. It doesn't work that way. We need to remodel the brain to get things back on track. And people think that's going to be impossible. It turns out it's not. The brain is moving all the time, every age. People used to think, oh, the brain stops remodeling when you're, a teenager. No, it's remodeling all the time. And so when someone's had chronic symptoms, they're the symptoms that are really being generated from the GI tract, and there's the symptoms that are actually being generated from the brain. And the brain's tendency to, instead of really pay attention to what's really going on, to pay attention to, I always think of it like a jukebox. Oh, I feel something in my gut. The brain's like, oh, I'll pull out that record, and puts on the record that says, you feel terrible today. Well, maybe the gut was going to be just fine if it hadn't taken that record out and put it on. But the brain is just being efficient. It knows how to drive me to work without me thinking. And it knows how to decide, oh, you don't feel good because you just ate something you shouldn't have eaten. So there's not a silver bullet for this. I started out my research trying to look at these very specific targeted drugs for irritable bowel syndrome, and none of them worked. So developmental drugs, the field kind of fell apart, because the drugs that we thought would be the silver bullet, they don't work because they don't address the key problem, which is the brain, the gut, and everything we put into our mouths, our environment. It's really, we talk about holistic medicine. This is holistic medicine. It's not one part of your body when we talk about the gut. It's everything. So we want to work on, when I try to work with patients, it's not just working on, I do prescribe medicines to say, I always say this is a crutch until we get you where we want you to be, right? So we give medicines to reduce symptoms, but those aren't the cure. Those are medicines to reduce symptoms while we allow the brain and the gut's nervous system to remodel and get back to health. And we do all that we can to support healthy habits, healthy eating, healthy lifestyle, healthy thinking, to get that jukebox to play what we wanted it to play, what it played when we were feeling better. And it's interesting, and that's often what people will do in hypnotherapy. Well, let's let's get you back to that state. Like, when's the last time you felt good? Sometimes you can get people to feel good. And they're like, wow, how did I feel good for that hour even? Well, if you can feel good for that hour, we can get you back to feeling good. We just got to break through all the things that are standing in the way.
That's fascinating that you can remodel the brain. Dr. Tillisch, most people, when they go to the doctor doesn't ask them what they're eating or what kind of stress they have, even GI doctors. But I know that for you, that's an important question you ask your patients.
Yes, and there are a lot of reasons why these questions aren't commonly asked. One is because most of us didn't learn about this, so we don't know. Our training in nutrition is, for the most part, dismal. I think it's younger doctors are getting better education in nutrition, which is fantastic. Sometimes there isn't even enough time, or we're not comfortable. We haven't had enough training to talk about people's stress, their mood. We might open up a can of worms that we might not know how to deal with, or might not have time to deal with, because, as you know, doctors are seeing people fast and trying to be efficient. And often that efficiency works fine, but for chronic disorders, we do need to take a little bit of time. And I think, it's interesting. It's a process of re-educating doctors and patients so that the patients are learning that these questions are important. Because sometimes I get pushback. What are you trying to say? I'm crazy? Why are you trying to say it's due to my stress? Why are you saying it's because of the way I eat? It's something else. And doctors get pushed back if patients want to ask a lot of questions about something that they don't know about. So it's re-educating patients to know that everything is important, not just one organ cut out of the body and set aside, and doctors to realize that too. And unfortunately, what we also need to go along with that is a medical system that allows us to work with a multidisciplinary team that can assist, because I may be able to get people a little bit of ways down the line talking about their diet, but nowhere near as far as a really good registered dietitian. So I work at UCLA with a team of fabulous dietitians who, when I've gotten to my limits, can help me get patients the rest of the way there. And it makes everything work better. When I get to my limits of being able to work with a patient on what should we do for stress reduction, I can teach people some simple breathing exercises. I can direct them to resources. But if we need a little bit more help, I work with a nurse practitioner, Suzanne Smith, who does mindfulness training. I work with a psychologist who can do cognitive behavioral therapy and hypnotherapy. And so we're really fortunate in our center to have everybody in one place. And it's a rarity, but I think it's a way that people are realizing medicine needs to move, because it's big. It's not something that one person can necessarily handle. In the old days, when we used to pretend that we had that silver bullet, that silver scalpel, and we could make it all better with our medical training, we thought, okay, we could go out there and do this on our own. I think it's really clear that approach has not succeeded in medicine. We need a multidisciplinary team in medicine, and we need our patients to know that we can't fix things with a cut or prescription pad.
Well, that's what our society wants, a pill for every ill.
Yeah, a pill for every ill. Well, I always say to my patients, I'm not holding back on you. Any of them that see that will recognize, if I had that pill, I would, and it was a safe pill, I would give it to someone. But in most cases, certainly in complex GI symptoms, that's not always the case. Now, I'm all for using what I call integrative medicine. So using all of the amazing tools we have in Western medicine, biologic drugs and surgeries and sophisticated procedures that can help us diagnose and treat illness. We've done that really, really well. But what we are just learning to do better is all of the stuff outside of that, where integrative medicine really helps us, where acupuncture may be helpful for pain for someone, whereas taking a pain medicine, whether it's something like ibuprofen or whether it's an opiate, both of which are Tylenol, all of which can have significant side effects and morbidity, and also don't work very well for some things. So we need to have those things when we need them, but maybe also I may need to know how to place some simple needles in the body that can relieve pain as well. And then patients need to realize that sometimes they've got to do something too. It's not passive. Getting out there and making some changes that may be a little tough is what's going to help in the long run. So I always try to have, what's our short-term plan? What's our long-term plan? In the long-term plan, really, for everybody, very few of us have achieved healthy eating, healthy living, healthy minds, healthy spirit. We can all, it's a continuous path for all of us. The more we're moving in that direction, the better we tend to feel.
That's great. So these mind-body interventions, can they benefit all GI disorders, or are particular ones better for particular disorders?
Yeah, that's a great question. Most of the research has been done in irritable bowel syndrome because that's an area where it's very common, about 10% of the population. There's some that has also been done in disorders of upper gut, we call it functional dyspepsia, and just a little bit in inflammatory bowel disease, which is quite different and is treated medically. So we need medications for that, and sometimes even surgeries for that. But there's a little bit of data that shows that people might do better with that, with mind-body interventions as well. And the reason for that is the mind-body interventions are they're going to help deal with, one, the distress of having chronic discomfort and pain. So part of our pain is what we feel in the nerves. Part of our pain is how we interpret it and how it impacts us. There's the old saying, pain is inevitable, but suffering is not. And so if we work on that suffering piece, it turns out it impacts those nerves and decreases pain. So pretty much anyone with pain can have improvements in suffering. But then we also go to, what about things like the motility of the gut, the immune system of the gut, the microbiota of the gut? And we think that we probably are making headway there. There's a few studies that look at hypnosis and actually changing the cytokines, the inflammatory chemicals in the lining of the gut. There are studies showing that meditation can change inflammation, can bring down inflammation in the body. And so there's a rationale that's biologic for how these mind-based things can actually improve gut health. As a side to that, when we feel better and we're suffering less, we also tend to make better decisions. And so we may utilize the medicines at our disposal more wisely. We may be more likely to avoid things that aren't healthy for us, like smoking. We may be, less likely to use other drugs that could be damaging, and we tend to be more willing to eat better. But when we're suffering, hard to change habits that may be adversely affecting us. So it works on multiple levels, from biologic to psychological to really practical.
Many of the mind-body interactions I've heard you talk about, like acupuncture or hypnotherapy or meditation or mindfulness, they seem to be things that are very relaxing that I've seen people use for other things, like, for example, anxiety reduction. So is there a connection that something that would just calm you would just be good for your gut?
Yeah, I mean, I think there probably, yes, but there is, I think, a difference. So people will say, well, I just like to watch TV. How about if I just watch TV? Or I'm just going to listen to music. They've actually studied some comparisons between listening to relaxing music and doing hypnosis. It turns out that probably is a benefit to anything that brings down the stress level. But interventions, particularly interventions that seem to change the breath and how we breathe, along with our cognitions, how we interpret things. to do that together seems to be what can change the outcome. And there are very few other relaxing things that do those things together. People will say, well, I like to burn off steam. I like to go for a run, or I like to go for a gym, and that makes me feel great. And I'm all for that. But what seems to help pain and anxiety, and really pain is what we're often treating it with in the gut, is something that that combines relaxation, slow abdominal breathing, and something that helps us shift our thought process to one that is really present moment and not thinking about how I might feel in a minute. So I feel something in my stomach. Okay. But if I feel something in my stomach and then all of a sudden I go to, oh, what's it going to be like in a few minutes? And am I going to have to stay home from work? And if I stay home from work again, my boss is going to be really mad at me because I'm out of sick days and I could lose my job. And I remember the last time I felt like this, I was home for 3 days and, I couldn't make dinner and my kids got really angry at me. And all of a sudden, I mean, just saying that, my GI tract was a little disrupted, right? I mean, it just goes right down there. And so, in addition to just feeling good and relaxing, we need to do something that allows that whole process to be diffused and allow us to just feel how we feel. And we may not like it, but we can accept it for what it is and deal with it rather than bring in all of the baggage from the past and all of our worries from the future and have that affect our body and how it's working. The gut just starts churning, and that affects the little microbes that live within it, and that can get rid of our probiotic, our good bacteria when we're under stress, and it can lead to this vicious cycle of symptoms. So yes, do all the enjoyable things that make you feel good and relaxed or good and activated, but also something that really does focus on how the brain processes things.
So are you actually saying that stress and worry can actually affect our microbiome?
Yes, absolutely. There are a number of studies looking at animals and how animals that are more stressed have a shift in their microbiota. There are definitely studies in humans looking at depression, showing that there's a shift in their microbes as well. There are studies in people who have irritable bowel syndrome that show changes. And it's an area that is really advancing the science. We know that if we give someone probiotics, certain probiotics, and then look at how their brain functions, we saw that the brain function changes in people who took probiotics compared to people who didn't. And there have been a number of studies, in addition to the one that we did, years ago now. So we know those connections are there. What we don't know is the details. So for you, what we know is with your microbiota, it really comes from usually the mom, but definitely the upbringing, what diet you ate, how many antibiotics you got, what you were around, right? And it's like a fingerprint. It's very, very individual. So for you, when you get stressed, you may have a shift in your microbiota that loses some bifidobacterium, which are some of the good bacteria in the gut. Whereas I may have a shift that loses some lactobacillus, which are another type of good bacteria in the gut. And when we lose those, we have a whole nother set of bacteria that now can flourish. And maybe in me, it's a bacteria that makes a lot of gas and slows down my gut and I might get constipated. Whereas in you, it may stimulate the gut to secrete a lot of fluid and your gut goes really fast. And these things change over time. And so it's one of the explanations for why people will say, well, how can I, for like with irritable bowel syndrome, how can I 1 week have normal bowel movements and another week I have diarrhea and another week I have constipation and I'm eating the same thing all the time? Well, every day is different. And the combination of food, mind, environment, all of the things that kind of go into making us feel the way we do it any given day, it's changing all the time. And so the gut responds, and in some people it responds very vigorously. Whereas in others, they may get headaches, but they have the cast iron stomach. They may have trouble sleeping, or they maybe get back pain. Their body works in a different way.
That's amazing. So how important is it what we eat for our optimal gut function?
It's essential. It's the one most important thing that we can change, because we can't change our upbringing or the microbes that our parents gave us. Like, that stuff is there. But what we can change is what we put in, what we feed ourselves and all of our gut microbes. And what we know about that is, we know that the diversity of fruits and vegetables, a lot of whole grains, not much animal products, if any, and really no processed foods, which is unfortunately a lot of the diet that people are eating in this country because it's accessible and inexpensive, but really upsets the gut. That's what's going to be the most helpful. And while I'm not a dietitian and I don't have the detailed knowledge to give people very sophisticated diets, what I do know is that if you can't recognize what that food is by reading the label, probably shouldn't be eating it. Eat simple, eat whole foods. It doesn't have to be complicated. You take fruits, you take vegetables, you take some seasonings that you can identify, and you make something with them. And, I eat a delicious diet without I don't eat frozen foods, things that come in a box or a bag. That might be something I have as a treat, but that's not what I want to put in my body as my basic. I want to be able to identify those foods. And if I don't have time to make them, I just eat them raw.
So I imagine that fiber is important.
Oh yeah, fiber is very important. So fiber is a prebiotic, is what we call it. It's the stuff that we don't digest, that the bacteria in our colons use to create energy. And they break it down and they use it to create nutrients that we can't make, that we're going to utilize. And it also keeps the fluid within the stool and allows it to move through nicely. And people will often say, oh, well, what fiber supplements should I take? I like to start with, well, let's see, what are you eating? Because, 25 to 30 grams of fiber is our lower level of normal. And almost none of the people in this country are actually getting that. So we got to get there. And it's not from eating salad, because that's the most common answer. Well, I eat a lot of salad, but the salad doesn't have that much fiber. So we want to look at all of the things they're eating. Are we getting up to that point? And if not, we want to put foods in to get up to that point. And if once we got foods in to get up to that point, so we filled you up with some good, healthy foods, then we can start talking about supplements. Because if you eat not such a great diet and then say, most people, when I get there, I say, try some psyllium fiber, natural psyllium fiber. If you put that on top of a really processed, fast food, terrible diet, you're just going to get a lot of gas and a lot of bloating, and it's not going to create the change we want. And then you say, like, oh, fiber doesn't work. Well, it doesn't work on top of McDonald's. It just doesn't. But it does work if it's done in a careful way.
Oh, that might be my favorite quote from the summit. Fiber does not work on top of McDonald's. We should get a T-shirt that says that. That's brilliant. How do things like hypnosis and acupuncture actually affect the GI tract?
Mm-hmm. Well, there's some studies with acupuncture, which I think is simpler, where they've actually shown very specific points on the body change gastric emptying times, so you can speed up the emptying of the stomach by using certain points. And in constipation, certain points that actually increase motility through. So we know that by stimulating these points that were identified thousands of years ago, by doing that, we're activating the nervous system. And by that nervous system activation, we're changing the way the gut moves. There may be some other ways that they work, say, secreting different things into the gut. But we know, at least in terms of motility, that it does that directly. With hypnosis, it's really interesting. Study that we did looking at brain activation in people who had bowel symptoms. And we did a study that sounds a little bit odd, but it turns out people who have a sensitive gut, if you blow up a balloon inside the gut, they feel it really intensely at a much lower level than the average person who is healthy without gut symptoms. And so we did this study where we blew the balloon up in healthy people and in people who had irritable bowel syndrome. And we looked at the brain and we looked at how the brain responded. And what happened is with the healthy people, part of the brain called the prefrontal cortex, the part is sort of our regulatory part of our brain, came online when we said, soon you're going to feel this pain. We're going to blow up the balloon, you'll feel this pain. This regulatory part lit up. There was parts of the brain that actually sense pain and how process pain. Those lit up a bit, but not much. And then when we deliver the balloon, those sensory areas lit up, but the patients felt pain. Okay. The people with the irritable bowel syndrome, we said, okay, you're going to feel this pain soon. That regulatory part, it didn't light up. And before the balloon even changed, the sensory part that shows that pain is happening, boom, lit up. The insula, which is this part that processes pain, that brings it to consciousness and decides how we feel, boom, lit up. The balloon has not moved. And they look like they're in pain already. Blow up the balloon, it doesn't even change. The brain has already processed the pain. Like I said, that record that you pull out of the jukebox and play that memory of what pain is, it's already there in people before the pain happens. But then you use hypnosis, which is, yes, it's relaxing, but really it's remodeling our thoughts and our nervous system reactions to life. Do that once a week for 8-10 weeks. We put them back in the scanner, and the people with IBS look just like the healthy people. That regulatory part of the brain was like, oh yeah, the pain's coming. I better light up and get ready. It didn't light up in advance. It wasn't preparing for it. It changed the way the brain responded. And by doing that, there's a whole extra layer of the brain that otherwise would be sending all these signals to the gut. Go faster, slow down here. Our stress response in the gut is to slow the stomach down. That's nausea, vomiting, bloating, and speed up the distal colon, the rectum. That's, oh, I got to go to the bathroom. Oh, I have cramps. So that stress response, hypnosis blunted that. So the brain really can control how the gut works. It doesn't just control how you feel about it. It controls how it moves, how it secretes fluid into it. It controls the immune cells that are sent there and how they react. And that's going to be, we talked about changing the microbiota. So hypnosis and acupuncture have real biological effects. They aren't just something that like, oh, you're relaxed, so you're complaining less. They're changing what's going on.
That sounds amazing. Because you also mentioned meditation. Hypnosis and acupuncture sound great, but when I think about meditation, I'm thinking like, oh my God, I'm just have to sit there for 20 minutes and do nothing.
Well, there's a beautiful study that Helen Lavretsky at UCLA did looking at 12 minutes of meditation and cellular health. And so it turns out that maybe all you need is 12 minutes. And who knows, maybe for some people it might be 7. For others, it might be an hour. So it doesn't necessarily have to be a very long time. It has to be long enough and sort of intense enough to break the hold that the world and your worries and stresses have on your body. And so some days that might be really quick. So for me, I meditate regularly. Sometimes if I just sit in my meditation posture, all of a sudden I feel so much better. It just puts me again, it pulls out a much better record to put in my jukebox. Pulls out a record that says, I feel good. And today is going to be a good day, right? So it doesn't have to be a long time. But when we're in a lot of stress, we just feel how you feel at the end of a day that's been rough. the body is tight. Often we'll be, like kind of hunched with the computer. We'll be like the hunchbacks coming on. All of those body signals are like telling us we don't feel good, and the gut feels that. And so you may get into your meditation posture, and the worries are coming, and you're like, oh, I'm trying to focus on my breathing, and everything's going. And it might take longer. And some days you might not even be able to release the hold on your body. But with practice, just becomes an easier record to pull out and put on the player. I don't know what a modern analogy is. A TikTok. It's a TikTok dance. Is it better for your body than that other one that you were watching? It just becomes a different pattern. And so I think for many people, meditation is the hardest one because it feels like you're sitting with nothingness. But when you train with an experienced practitioner, so mindfulness-based stress reduction is the most evidence-based of the meditation practices for anxiety, depression, irritable bowel syndrome, chronic low back pain, post-traumatic stress. It's very structured, and it doesn't leave you hanging. It says, we're going to do these things together. It's 2 hours every week for 9 sessions, and you have homework, and you know what to do, and you practice these things. And eventually, over the course of practice, it takes hold. We know what you practice grows stronger. So if you're practicing tension and beating yourself up and never letting yourself relax until you fall asleep, that's what you're going to be stuck with. We got to intervene, and we have to practice feeling calm, feeling relaxed, visualizing positive things. And then we're going to feel better. So I'm never going to say that it's easy. But for all the people who say, oh, I can't do that. My mind goes too fast. I can't meditate. Well, okay, maybe just sitting and meditating to start with isn't the way to do it. But most people can do it within a group setting, or they can do something like Tai Chi, which I have a lot of my patients do, where you're not just meditating, but you're moving at the same time. And some people, you need to keep the body moving and moving slowly. And one of the magics of Tai Chi is people will say like, oh, it's too slow, I get impatient. Like, that's the point. You need to slow down the body and then slow it down some more. Because if you can learn to move the body really slowly, the brain loves that, and it makes it feel relaxed. So all these, there's so many, this is the joy of it, so many different things that you can do. And there's a different one that's going to work best for each individual. The key is to be open-minded and not to jump ahead and say it's not going to work.
Do you find that your patients are open to these body-mind interventions? Because so many people with GI problems have had them for years, whether it's chronic constipation or IBS, and I imagine they do take some time to work.
Yes. I mean, it's easy for me. People come to me because this is one of their interests for the most part. But even when I see people, sort of that weren't really coming for any particular integrative medicine approach, most people are pretty open to it. I'd say the most difficulty we have is finding providers to work with them, finding time, quite honestly, finding money, because their insurance will pay for me. They'll pay for me to do all kinds of endoscopies and tests, but it's not going to pay for them to do Tai Chi. It should, but most people, some insurance will, particularly a capitated system where we're paying for the whole person, because it's going to be cost effective in the long run to do all of these things. But for many of my patients, it's not that accessible because it's a carve out from insurance. And so I try to work with people to find things that they can do low cost. I mean, using the phone, there's an app for everything. There's plenty of meditation apps out there. Some of them quite good, some of them not so good, but people practicing and hearing different voices, going to YouTube. I love to go to YouTube and do Tai Chi with different instructors and find different things that people do. We have access to so much. So even when we don't have access to a one-on-one provider or even a group, which is often still quite expensive, there are things that we can do.
It just sounds like even people that don't have GI disorders would benefit from these modalities, because we're living in extraordinary times right now with so much stress that we didn't have before.
Yeah, so it's a huge stressor and a trauma to, the globe. And so this is a time where I in particular talk to my patients who have time, a little bit of carved out. They used to have that hour commute. They used to have that extra hour. They had to get dressed and put on their makeup or, tie the tie. That they're doing things from home. It gives people a little bit of opportunity. And so in the darkness of all of this, I think it's really important for us to use this for whatever opportunities it provides. And it provides us often some time to separate from people who may be giving us more stress in the external world. It allows us to go internally and to give ourselves a little bit more time to sleep and to be thoughtful and to meditate, to potentially have a spiritual practice if that's something that people want. It gives us some more time to think about what we're eating, because we're preparing it for the most part in our homes, because people aren't going out as much. So as stressful and difficult as the times are, they also, I think, allow us to potentially make changes that when we were on our treadmill of life, we just we weren't able to do. We didn't allow ourselves that time. And now if people have that time, it's absolutely a time to utilize it. And I've heard that back from people where they say, it's funny. I thought I'm really stressed about this, and I thought it would flare my symptoms, but it's not. I'm actually doing much better. And it's a great thing to notice when you're forced to stop and hop off that treadmill that we do like to be on frequently. We can actually allow the body to settle and feel healthier. So definitely let's all take that opportunity, because there's so many other parts of it that are driving us all crazy.
Yeah, that's great. I once heard you say that exercise changes what's going on in the gut. Does it have to be vigorous exercise like running a marathon, or is even gentle walking or yoga good for the gut?
Yeah, well, I think yoga is great for the gut because it allows twisting and bending, and it focuses on meditative breathing. And that abdominal breathing from yoga is what tells the gut that everything is okay and allows it to settle down. So yoga is fantastic. But when we get back to gut health, is really overall health, right? It was kind of where we started. Getting exercise, regular exercise, does seem to help the gut microbes. We don't know the mechanism by which that happens, but people who exercise have a more diverse gut microbiota. And in general, even a simple exercise program like walking, we've shown that can help irritable bowel syndrome. So whether for one person, a vigorous exercise might be a walk around the block. I have some patients where that's not even achievable. Their vigorous exercise may be seated, but really moving the arms and legs and twisting and moving the body. I'm a big believer in diversity generally as being good for our health. So it's diversity of the diet, diversity of movement. We sit in this chair. I say to my patients, you do this all day long, right? We walk, we run, we type. Yeah, maybe we reach something and we reach down to get something, but we're not doing a diversity of movement. And that's where there's a reason why yoga and Tai Chi are ancient practices that have continued for thousands of years, because they have health benefits. And it's really a diversity of movement, stretching, flexibility, all these things within our potential are the key. So it's not a one size fits all. When I'm 100, I'm going to be still doing some yoga and Tai Chi, but it'll probably look a little different than what I do now. And that's okay. That's what's right for my body, right? It's just as damaging to have someone whose body cannot withstand a hard workout, a punishing workout. You know, the person who's my age in my 50s, I go to the gym and work out too hard. This is where we get knee replacements, hip replacements, all these other problems. So I'm not saying go out and punish yourself. It should be, it should feel good and be good for you.
Yeah, that's great. I know you've done a lot of research. Could you please talk about some of the results in your MSBR research?
So in the mindfulness-based stress reduction, what we showed is that, like others have shown before us, that this simple intervention of learning to basically just learning to be in the present moment without judgment reduces symptoms in about 3/4 of the people who do it. And in what we showed was that there are different aspects of that that may be more important than others. And so the thing that seemed to be most resonant was acting with awareness. So there's different components of being mindful. And so acting with awareness, rather than going on autopilot, seemed to be the most important feature of mindfulness that led to better symptoms. We're now looking at the brain results from that study. And it's really interesting. We look at people who responded to the mindfulness and people who didn't. And those people who responded to mindfulness developed a whole slew of new connections in the brain before to after. Their brain was much more connected to other regions of the brain, really communicating. Whereas the people who didn't respond, they either had less connections or no change in those connections in the brain. So the brain stayed in its same song that it's playing, rather than opening up to all the different possibilities. So really, it's why I love brain imaging research so much. We have ideas from talking to people and learning from people of what we think is going on. And then we can actually watch the mechanisms of how that happens. And so I probably didn't need to have the brain to show me that after a mindfulness training, our brain is more awake and alert to everything around us, rather than before when we're just focused on our internal ruminations and thoughts. But it's very powerful to see that in the data. It's really supportive. So hopefully those results will come out soon as well.
That is fascinating. When a patient is open to trying these mind-body interventions, do you direct them to all of them or one of them? Like, how would I decide? Do I go for hypnosis or acupuncture or Tai Chi or meditation, or do I just try all of them?
Yeah, well, I think that most people will have, if I give them a little sense of what they are, they either come with some biases or they come with some interest. And I think the most, I'm a person who listens to my gut. If it seems like a good idea to you, that's the one that I'm going to pick. There may be some data that's a little stronger in one thing versus another thing for the whole population. But if you say, this sounds like I'd like to do it, that's the one I want you to try, because I think it's the most likely that you're going to actually do it. And you'll probably be benefit. And often people might start with one thing and we may branch out and add something on. So often we might start with a movement intervention because which there's less data for pain and for IBS, but there still is. We might start with that because it seems the most accessible to someone, for example, who fears sitting in one place and being with their thoughts. So we might start with a movement intervention. And when they realize, oh, yeah, that's feeling pretty good, we might say, okay, well, let's do something that is really, really more brain focused, whether it's cognitive behavioral therapy or mindfulness or hypnosis or one of these other things. Whereas other people just like the idea of something passive, to be honest. Hypnosis, I'd like to sit in a chair and have somebody do that to me. And really, hypnosis is not doing it to you. All hypnosis is really, the work is done by the person with a guide, but it feels like less work, I think, to some people. And so that might be the way you want to go. Whereas someone else might be hypnosis. I don't want you controlling my mind, which it doesn't do, but it makes somebody uncomfortable, I'm not going to go with that as my number one thing. So what we have available to us, what we think is interesting, you know, do everything. I mean, that might be a little bit too much, but I think, again, diversity is so important in all aspects of our life. I like to add things on. And sometimes I may be more, some points in my life, I might do more of one than another.
They all sound great, actually.
Yeah.
Acupuncture sounds the best to me right now. If I was going to choose one for some reason, yeah, that just sounds very relaxing. And again, I just have to lay there. So
Right, it's true. Whereas for me, the idea of the needles, I'm a little needle phobic. So it's something that took me a while to get used to. I had to treat a lot of patients to feel comfortable giving it myself. So yeah,
that's interesting.
Yeah, it is. It's about our own biases, interests, and putting those together and deciding a really personalized plan for each person, and not just assuming just because the data shows acupuncture is good for this, that it's necessarily the right one for everyone.
Yeah. So I work with people trying to get them to eat healthier. And one of the reasons they say they can't is because of these various GI issues, which is the reason I wanted to produce and host this summit. And the number one symptom that I get people telling me that distresses them, even worse than constipation, which is horrible for the people that suffer with them, is this abdominal distension. And it's not just women, it's men. And we're not talking about the sensation of bloating, but where they look like they're pregnant and they feel so bad. Is there any kind of a more immediate relief? Because I'm sure that these modalities, they don't work immediately on the bloating, do they? Because people are always saying, I can't eat fiber, I bloat, I distend.
So the distension is a fascinating thing, and it's a very tricky one to treat. And it's not as common as the sensation of bloating, which is also really uncomfortable. But the distension is an abnormal reflex that the body has. And basically it feels like it just got so much stuff in it, it needs to make space. And so it actually rearranges the muscles, the diaphragm and the muscles of the abdomen to make space for that huge meal that you didn't eat. So I have patients who will say, I drink a sip of water and boom, it's out, right? And so we know that's not normal physiology. That's something going wrong. It's basically a reflex that's gone wrong. And so we try to improve it by reducing things that are triggers if we can. We sometimes will use medications to increase the motility to try to move things through. We sometimes use medications to blunt the nervous system response. But in the long run, remodeling a reflex is remodeling the nervous system. And so it is something that for some people may take some time. But I have to say, it's not, I've not found it in my practice to be very fiber specific. It may be one of those things people think about, but it seems like it can happen with almost any food. So so I wouldn't blame fiber for that one. But like I said, we have to be really careful about how we use fiber. You know, it doesn't get rid of all the problems in the diet. It's something that really is it should be a foundation that we're building all these healthy things around. It shouldn't be an air freshener over a great big mess.
I'll never forget that you can't add fiber to a Big Mac and hope to have your health back. That's my biggest takeaway. Dr. Tillisch, what are your best tips for people just in general to promote optimal GI health?
The key basics. So whole food, plant-based, healthy diet is a great way to start. Working on stress reduction, not feeling like you have to wait to fix your whole life and everything in it, but realizing that you can change the way you and your body respond to the stressors that may be inevitable around you. So some kind of meditative or relaxing practice, physical exercise. I mean, really, they're the things that if I happen to be an endocrinologist and you said, how can I best manage my diabetes or prevent diabetes, they're going to be the same things. Heart disease, they're going to be the same things. These are the ways we can prevent the majority of chronic illnesses in our country, whether it's musculoskeletal pain, heart disease, cancer, diabetes, digestive dysfunction, mood disorders. These affect all of them. And so if we can build that foundation, everything else that we do is going to be a lot easier. Choosing maybe a medication now and then, choosing a supplement now and then. But if we don't fix those basics, we could pour every supplement in the world on top, and it's still not going to feel good.
It sounds like what you're talking about is the foundation of health, and that what's good for the gut is good for every part of the body.
Absolutely.
Yeah. So, Dr. Tillisch, what is the truth about GI health?
Well, the truth about GI health is it's just as easy as it is hard, I guess. The things that we need to do to create GI health are those simple things that we all kind of already know, but most of us have a lot of trouble doing, that we just talked about. If we can build a foundation for health generally, our GI health is probably going to fall in line. And those aspects of it that may still be problematic are going to respond much better to conventional medical therapy.
Great. Thank you so much.
No, you're welcome. Happy to talk with you. It's been great.